Right.
I'd like to talk about that because I think quite recently there was a drug conference held here in Nashville.
That's right.
And one of the points that I think was made by the Secretary of Health, Louis Sullivan, had to do with the responsibility of other people outside of the government agencies to become involved in this as a fight. And he indicated that approximately $11 billion will be used by the government, that is part of the proposed budget, to deal with this as a problem. Do you find that we're receiving adequate support from the federal government in terms of dealing with these as problems, that is the treatment problem and the education problem? And if not, what can be done in order to get greater resources for this as a problem?
Well, we have had a tremendous influx of federal dollars into the state to deal with the problem, and we're very appreciative of that. Unfortunately, it's not enough. Since 1986, there's been a 400% increase in alcohol and drug spending in the state. We've been able to get some basic educational programs in place. We've been able to get a minimal network of services for at-risk kids out there. But there's a tremendous need still evident, particularly in the area of treatment. We're talking about a process that's very expensive, and that we have a very large number of people in need of. It's not unusual for a treatment facility that takes patients who can't afford to pay to have a 5 to 6 month waiting list. So there's a lot that we still need. It looks like we will continue to receive strong support from the federal government. The amount of funds has increased as opposed to declining is something we were a little concerned about with the change in administration. And it looks fairly solid for the next few years. But there's still, obviously a long way to go. I think we hear a lot of folks saying, well, we need to be putting these people in jail, we need to be putting them in prison, catching these people and putting them away. But there's there's a cost factor involved with that. We were just beginning to get our prison overcrowding problem dealt with. And one of the big problems we run into is we've been so successful in drug law enforcement that now we've got all this new influx of persons into the correctional system, and how do we deal with that? So many of the inmates in the correctional system also, they have alcohol or drug-related problems themselves. And we've been working hard to try and get some treatment programs there so that hopefully while they're staying with us, we can help them address some of those issues that might have brought them in there in the first place.
Very good. Over the last 2 or 3 minutes that we've got about 3 or 4 minutes left. Let's talk about the most recent conference that was held here, the World Drug Conference, because I think that points out the role that Tennessee is playing, not only on a state level, but on an international level. Why don't you give us as much information?
Well, I'm glad you asked about that. We're real proud of that. We're real proud of that. The Governors Alliance hosted the Pride World Drug Conference March the 14th through 16th. We had close to 8,000 people from literally around the world in Nashville. This is the largest gathering of anti-drug advocates in the world. We had folks there from 60 or 70 foreign countries and all across the United States. And was an excellent opportunity for Tennesseans to get exposed to the latest in terms of what's going on. The thing that was really gratifying for us is that one of the reasons Tennessee was selected as the site for this conference was our reputation for a really strong community-based attempt to deal with alcohol and drugs. So we were really excited about that. It was a great opportunity. You mentioned Secretary Sullivan and numerous other really world-class experts in the field were here. And it's just a great time for us to toot Tennessee's horn a little bit, and also to be exposed to some things that can hopefully help us continue to move forward.
In this last minute that we've got, what are some of the proposed programs and some of the proposed problems that you see in terms of trying to deal with this as a real problem?
Well, this year in 1991, every year we try and focus on a particular issue. Last year was the year of the family. This year we are really focusing on at-risk groups. There are folks within Tennessee that, for any number of reasons, are at a significantly greater risk of developing problems. So what we're trying to do is get out there with programs and resources to help reduce some of that risk. Some other things that we have going on, we're going to be focusing this year on the workplace. 4 out of 5 illicit drug users are in the workplace. And Tennessee businesses lose buku amounts of money.
Thank you, Mr. Herrmann, for that information dealing with the problems that we face dealing with drugs in the state of Tennessee. And let me encourage you to tune in again next week for another informative edition of Comments. Good morning.